So breaking at 4, Kentucky health officials are reporting a third infant has died from pertussis in the past 12 months. The state has seen a significant spike in cases with more than 560 identified this year. Officials are urging everyone, especially pregnant women and infants, to get vaccinated to prevent further spread.
Yeah, so under this new leadership, who should be getting tested? And we have no basically guide anymore, right? We already been talking about this, Dr. Brown.
Hello. I am Dr. Haydée Brown.
And I'm Dr. Sonya Sloan.
And we are AYA, Black and Brown Women Disruptors in Healthcare and Beyond.
Yeah, so today we are still frustrated as usual. Dr. Brown didn't do her normal sigh as we lead in, but we're talking about outbreaks, the kind that Dr. Brown and I have not seen and no one should be seeing in this year of 2025. Dr. Brown?
And it's not new viruses, right? These are old diseases that have been revived from the dead. And ridiculous. Our babies are paying the price, and they're paying that price first. Kentucky has now lost 3 infants. There are 3 less babies on this earth due to whooping cough, which is preventable. And it's all because they're too young to be fully vaccinated. The protection actually depended on the adults around them. And this isn't isolated. More than 25,000 cases have been reported nationwide this year, well above pre-pandemic levels, and climbing towards the worst outbreaks we've seen in over a decade. And again, these are preventable diseases. And this is loss. These losses are devastating. And that's especially for newborns who cannot fight the infection on their own. Let's roll the clip.
They're just kind of heavy. Uh-oh. There we go. Okay. It's okay. Okay, take a breath there, honey.
I get chills literally watching as a parent and seeing your child struggle. That is what we call whooping cough. If you've never heard it before, that's when it's also known as pertussis. It's a very contagious respiratory illness that's caused by this bacteria called Bordetella pertussis. And the bacteria basically attacks within the lungs, the hair fibers. It looks like hair fibers. We call them cilia. And it releases these toxins that damages the airways and causes swelling. And so therefore, babies struggle to cough and to breathe. And this is an illness that is so dangerous for them because they don't know what's going on with their bodies. And even young children, may not know. And if parents have never seen it or heard it, they don't know to get help sooner. And so several deaths have already been recorded this year in Louisiana, Washington State, and Kentucky. And officials in Kentucky said the 3 infants that were all unvaccinated basically died of whooping cough in the past 12 months. And that's the first since 2018 that this has happened. And in overall, this is the highest number of cases since 2012, you guys. And Dr. Brown, they said that they had 566 cases in 2025 so far. We're not even at the end of the year. And at the same time, we have New Jersey. Their ERs are now being overrun with RSV and flu. And New York has flu alerts that are going out, a huge spike in cases to the point where there's been warnings to go out. Let's roll this clip.
In tonight's Health Watch, forget about being jolly. 'Tis the season for the flu. At least that's what experts are saying. New York and New Jersey already seeing an uptick in flu cases and also hospitalizations. And as Andrew Ramos reports, with the holidays right around the corner, it's bound to only get worse.
I feel like I eat healthy, I exercise, get plenty of rest.
They say having a positive outlook is the key to success, but when it comes to the flu, you may want to have a backup plan.
Every year we get the flu shot in my family, I think, and obviously it's helpful.
Getting the flu shot may be more critical than ever this season as a new mutated strain of the H3N2 flu virus is raising concerns around the globe. That strain known to pack a punch.
Over in Japan, it was an early, and it looks like a little bit of a harsh flu season, and there's a mutated form of the flu virus.
Locally, flu cases and hospitalizations are steadily rising, where New York City reported 2,400 cases this week, a 78% surge from the week before. In New Jersey, flu test positivity rose to 0.7%, mostly impacting patients 65 and older. And Connecticut reported its first first death from influenza virus of the 2025-2026 season.
78%.
I mean,
that's in your state. That's in New York. East Coast, man, it's killing.
It's killing us, so this is a notice. Get your flu shot. The past right now is just walking right back into the future. And this is why, because it's not just hesitancy, right? This isn't just vaccine hesitancy. It's policy. The CDC's vaccine committee was rebuilt this year, and that's been with political allies of RFK Jr., people who've challenged childhood immunizations for years, for decades. And now they're targeting the newborn hepatitis B shot, a vaccine that cut child infections by 99%. I'm going to say that one more time, by 99% since 1991. And Dr. Sloan, what people need to know is that the science hasn't changed. The politics have. What do you think?
I think we're in very dangerous territory once again. It's not just the misinformation that they're spreading, because it's really more about the suppression. If they're saying that's not happening, then no one even knows what to be looking for, right? And that's what's dangerous. Public health experts are now even warning Americans that we're not even to trust this new advisory committee on immunization practices, the ACIP. And so actually during they basically voted against hepatitis B vaccinations for mothers who have not had hepatitis or are at risk. Let's roll this clip.
The committee has voted 8-3 in favor of removing the universal recommendation for a newborn dose of the hepatitis B vaccine. This was obviously a contentious vote. It was delayed multiple times. And among the 3 people who voted no, Dr. Cody Meissner, who's among the most respected by outside experts, panelists here, said, quote, "We are doing harm with this recommendation." That was seconded by another no vote, Dr. Hibbelin, who said he hoped that the committee would take responsibility for the harm that may ensue from this recommendation.
Yeah, I hope they do take responsibility, because they basically have put more people at risk to die from a disease that had basically been decreasing. And in fact, the virus kills 1.1 million people globally, hepatitis B, each year. So the new members of the ACIP, now entirely appointed by HHS Secretary Robert F. Kennedy Jr., said they didn't have enough time to review this proposal language, so they wanted to wait. And so they voted on it today, and they voted against new babies having a hepatitis B vaccine unless the mother had had some type of risk or did have Hep B. They're wanting to put it back in the parents' hands. But what about the communities? What about the rest of the environment, the rest of us that also exposes people? So every year, this panel, again, is going to decide on what vaccines can or can't be. And again, they're handpicked anti-vaccine activisms. These people do not care about babies dying right now. And so the other thing we need to worry about is the ACIP's recommendations usually affect health insurance coverage. So if they say no, don't pay for it, then people are now going to have to pay out of pocket. People that can't afford to pay out of pocket. And that's how deadly childhood diseases continue to spread. And so experts are saying they are no longer credible. This committee that the CDC has appointed aren't credible. We can't trust them. And that's what's scary. In fact, one of the quotes from Peter Hortes from the Baylor College of Medicine says, the new version of the ACIP has been stacked with anti-vaccine activists who either have no interest in the science or no ability to understand it. Damn, that is hard, because even the couple of people that said, we want to hope that you basically take responsibility for this, we know that's not going to happen. So health surveillance systems are being scaled back. We're no longer tracking RSV hospitalizations, localized flu spikes, or even measles spreads, right? We've seen this playbook before. Donald Trump's administration, their data is altered. It's delayed, it's blocked, because whenever the reality made by leadership looks unprepared, they basically say it doesn't exist. And so the fact is, the numbers are making them look bad. And the strategy is just stop counting. You guys that have not seen public health get worse, we're going to see it get worse. And we're being gaslit by the current administration, Dr. Brown. What are your thoughts?
So the real public health threat here is autocracy, right? So autocracy doesn't start when your leaders tell you what to think. It starts when they decide what you are allowed to know. And if you don't measure disease, you can't prove the neglect. If you can't track your outbreaks, you can't demand action. And so with no data, there's no accountability. And that's how leaders can stand at a podium and claim everything is fine, while ERs overflow and infants die from preventable infections, not because medicine failed, but because the government hid their truth. So to the public, it becomes no data, no crisis. And that's not transparency, that's control, right? So here's the twist. Control isn't government power over people, right? Real control is people having the information to protect themselves. Control is knowing that the water you drink isn't quietly contaminated by a big donor to the current administration, right? Control is formula that won't poison a baby. Control is trusting everyday products aren't laced with asbestos, a regulation that was just lifted. Control is raising a family without needing a medical degree to avoid being harmed. So public health isn't big government. Public health is the right to not be poisoned or deceived. And so Alexis de Tocqueville said, democracies actually depend on civil society, which is people acting together, right, by choice. And that's public health. It requires trust. And we saw this, right? During COVID, autocracies used these harsher lockdowns and surveillance to force compliance. But the democracies actually achieve better compliance with less force. And why is that? It's because people in democracies act together. People in autocracies act out of fear, or they don't act at all. So autocrats, they don't build trust, they kill it. So without trust, you don't build a health system, right? You build a police state. You enlarge your ICE force, right? The history shows that more people die from public health collapse in war than from weapons, right? So more people are dying from diseases than bullets. And autocrats, they're not rebuilding clinics, right? They're rebuilding these armies, they're rebuilding propaganda, and they're letting disease quietly wipe out people that they consider expendable. Your Black and brown populations, your political opponents, your migrant workers, the rural poor. And autocracy is killing without even pulling the trigger. Because the autocrats, they don't fear the disease. They don't fear those babies dying from whooping cough, right? They fear the evidence that the babies are dying from whooping cough, because evidence exposes their failures, evidence demands their accountability, and evidence empowers the public. So the autocracy that we are currently in is the public health crisis, because public health is a human right. And when truth disappears, the first to die are infants, look at Kentucky, pregnant people, immunocompromised people, meaning your neighbor that has cancer and is on chemotherapy, or another neighbor that may have a rheumatologic disorder like lupus and have to take medication that makes their immune system not respond to illness the same way. And then there's also your Black, brown, rural, and immigrant communities. So autocracy isn't just democracy dying. It's people dying because evidence was censored and hidden on purpose. So when a government controls information instead of disease, even the virus, a virus, whooping cough, anything, measles becomes a weapon of power. And so Dr. Sloan, history shows when truth becomes optional, equity becomes impossible. What do you say?
I say it's time for the call to action. So if you're listening, we want you guys to understand, again, you cannot be silent. That's what they want. The call to action, when the government stays silent, then we have to get louder, right? You have to get those newborns their vaccinations. Get the shots, please. Please get the shots. And if you're pregnant, get vaccinated, because they're not going to protect you or your baby. And don't argue with misinformation, because, you know, we're all on social media, we're on these platforms, and people are going to come at you. Don't argue with them. Just replace it with facts. Science doesn't take away from people's freedom. It never has. Science protects us. Autocracy hides the truth. And public health, we need it to be given back to us. And that's through our voice. So control doesn't come from vaccines. Control comes from truth and science and transparency. And how do we keep each other safe is by being loud. So we want you guys to stay vigilant, stay informed, stay loud, but stay vaccinated. Get your shot, get your flu shot. Because we're AIA, contributors of the MeidasTouch network, and we are proud members of the Meidas Mighty. Please like, share, subscribe, and help keep the truth loud. Have a great week.
Thanks, everyone.
Want to stay plugged in? Become a subscriber to our Substack at MeidasPlus.com. You'll get daily recaps from Ron Filipkowski, ad-free episodes of our podcast, and more exclusive content only available at MeidasPlus.com.